Hey everyone, Doc T here. Thanks for joining me for another episode of the Horse Advocate podcast. This one's going to be a little bit different because I'm going to be reading a script that I wrote. Here it is, and interjecting a couple of times with some extra thoughts. But let me just start reading, and you'll see where this is going, where it came from, etc. So the title is called "Should Non-Veterinarians Be Allowed to Float Horses' Teeth?" So this podcast is more formal than usual because I'm reading a script I wrote in response to a graduate of my dentistry school challenged by the Veterinary Medical Association of her area. She is a non-veterinarian working in equine dentistry. Most of the United States allows individual states to determine what a profession is, and most states broadly state that veterinarians are the ones to perform medicine, surgery, and dentistry on any animal. This statement includes fish, reptiles, birds, and any other animal other than humans. It is the prerogative of the veterinary board to investigate anyone who does any work on any animal in their state. However, routine care of animals, including preventive medicine, is usually avoided. You can purchase and administer vaccines and dewormers, adjust angles on hooves, apply therapeutic shoes, prepare any mixture of medical supplements, breed horses, deliver foals, apply liniments, clip hair of horses not shedding, splint crooked legs of foals, adjust bones, massage muscles, apply red light, PEMF, and a dozen more things to a horse without being a veterinarian. But you cannot remove the unworn parts of the cheek teeth in horses, digging in their sharp edges into the tongue and cheeks and causing pain with every movement of their jaw and tongue. Nope, you have to be a veterinarian in almost every state of the union in Canada and other countries. I've been training veterinarians and non-veterinarians in the technique of horsemanship dentistry. My definition of this form of working on horses' teeth is as follows. 1, removing sharp points from horses' cheek teeth by filing them to a smooth edge is commonly called floating teeth, but is also known as odontoplasty. The root cause of most dental problems is pain in the tongue and cheeks caused by sharp enamel points. Therefore, routine maintenance of the horse's teeth removes pain from these sharp points. Secondary to the removal of the sharp points is finding pathology and addressing this. Number 2 here, administering sedatives to horses for routine floating is unnecessary. Instead, horsemanship skills are used for 97% of the horses I see from annual data consistent over the past decade. The remaining 3% are horses that are reactive to pain, fear the process, or have a painful procedure done, such as extracting a fractured cheek tooth. With those, I administer pain and anxiolytic medications, not sedatives. My name is Geoff Tucker, and I am a veterinarian who graduated from the New York State College of Veterinary Medicine, also known as Cornell, in 1984. I have worked professionally with horses since 1973, starting at a saddlebred farm in Ohio and moving to a thoroughbred breeding and training farm in New York that same year. I completed my undergraduate degree at Cornell University in 1980 and graduated from veterinary school in 1984. In my autobiography, I tell my story. It's called Since the Days of the Romans, My Journey of Discovering a Life with Horses. It's available on Amazon, and you can listen to me read it right here on this podcast. While in veterinary school, my mentor told me the importance of maintaining horses' teeth. With him, I floated my first horse in 1983 and made this a part of my practice in 1984. Since then, I have logged the number of horses I've worked on or who I have taught. In February 2024, I recorded my 80,000th horse. But I always continued learning about horses' teeth and oral cavities. I have attended many continuing education courses offered by veterinary professional organizations in person and online. The New York State Equine Practice Committee invited me to join them in 1996. The reason for this invitation to the board, they told me, was because I perform more dental care on horses in New York than any other vet at that time. And veterinarians were becoming interested in claiming this aspect of horse care for themselves. Non-veterinarians did much more, including all the racehorses at Belmont, Aqueduct, and Saratoga. As one board member stated, this discrepancy between veterinarians and non-veterinarians floating horses was because no good horse vet has time to add floating teeth to their busy schedule. There was one practitioner on the board who, at that time, was stating that only veterinarians should be floating horse teeth. I and the others were somewhere in the middle of these two thoughts. We could not reach a consensus, and we dropped the discussion, knowing it would require much more work than anyone wanted to do for an issue being done well by non-veterinarians. The interest of the practice committee and the New York Veterinary Board came from the introduction of sedation and power floating equipment, and veterinarians started claiming their position from the non-veterinarians to broaden their base. There was no discussion that a non-veterinarian was less able to float teeth, nor were non-veterinary dentists cheating owners with poor quality of service. Well, cases of lapses in integrity came from both sides, mainly because floating horse teeth is hard work and requires horsemanship skills, and visualization of the finished float by the horse owner is within the depths of the mouth. In 1999, I attended the Ocala Equine Conference, where a non-veterinarian spoke about filling cavities in horses' cheek teeth. So that's quite a movement from 1984 when I graduated to 1999. I was shocked when he stated without any evidence that horses would live on average 5 years longer if we all started performing this procedure. This same man was later banned from working on horses in several states, became the president of the IAED, which is the International Association of Equine Dentistry, and became the director of equine dentistry at the University of California, Davis Veterinary School. While this non-veterinarian was working at this vet school teaching veterinary students, he caused injury to a client's horse. And according to her, she emailed me and called me for all this information. The man was sued, and then he and the director of the hospital who had hired him were fired from the school. On another front, a non-veterinarian equine dentist was teaching non-veterinarians how to float teeth in South Dakota in the late 1980s and 1990s. He was vocal that veterinarians should not be allowed in the horse's mouth because they had no training. His voraciousness upset the veterinary board, forcing him to leave the state and reestablish his school in Idaho. Throughout the turf battle of who should be allowed to float teeth, I continued to apply and improve my skills throughout New York. 1984, no textbooks on equine dentistry were available except one written by non-veterinarian called Sound Mouth, Sound Horse, The Gauger Method of Equine Dental Care by Ed Gauger. I'm showing it to you in the video. It says on the back page, the first and only complete book about horse dentistry. Learn how to safely inspect a horse's mouth, recognize when dental care is needed, judge the quality of a practitioner's work. That's funny. Treat mouth injuries, recognize when performance problems are tooth-related, use dental tools, save money on feed bills, determine a horse's age. This book, written by a non-veterinarian, was the only book in the veterinary school during my education on horse teeth. And the publication date of this book is 1983. So it came out in 1983, the year before, and the very year I was started float teeth. I ended up having lunch with this man in New Jersey once. If we want to go over the other books, this book here is called The Vet Clinics of North America. It was a subscription for equine veterinarians. This one is called Equine Practice, and this one is dedicated to dentistry. It was printed in August of 1998. And there are some interesting people in this book that I know some of these people. I've listened to them talk, and I think this is one of the very first books that came out under the veterinarian label for veterinarians that I know of. The next book that came out 2002, and this is Equine Dentistry, a practical guide by Patricia Hentz, and she's the DVM, Diplomat American Board of Veterinary Practitioners in Kimberly, Idaho. So that was the next book that came out. Then the first edition of Equine Dentistry by Gordon Baker and Jack Easley, both veterinarians. Oh, I've got this backwards. This one is 1999. So this one came out for equine dentistry. Okay, so the vet clinics in North America was 1998, right here. Then 1999 was the first edition of Equine Dentistry by Gordon Baker and Jack Easley. Then came out the Equine Practical Diet by Patricia Hentz. Equine Dentistry had several editions. That was 2005 and 2011. And this is the 2011 edition. And as far as I know, it's the only other edition. I don't know if they've come out. I'm sure they've come out with others. I just stopped buying them. All right, so that's 2011. This one is interesting. It's called The Manual of Equine Dentistry by Tom Allen. Tom Allen is also a veterinarian. I don't know why they don't put DVM on the outside. It's also written by two other authors. He's from Missouri. And okay, so he's the one who wrote it. What's interesting is contributors here has the first contributors, the man I told you about, who was kicked out of the States, injured the horse, and was fired from UC Davis. They have a lot of these certified equine dentists from the school, including the man who set up in Idaho, and this be-all and end-all guy down here in Florida, who people say leave their barn in a bloodbath when he's done, but that's just the way it is. Then, of course, Dale Jeffrey is the man I'm talking about in Idaho, who personally sent me this book, and copyright was 2004 to 2009. So basically, what I'm trying to get across to you is there's only one textbook at the vet school in 1984, and that was written by a non-veterinarian. No veterinarian had any interest in equine dentistry in 1984. The very first time we start to see something coming out that's official about horse teeth in a textbook is Vet Clinics in North America in 1998. At that point, 1998, I had already practiced since 1984. So that's 14 years. I'd been floating teeth the whole time. I had sold my practice. I had moved all the way to Florida, and I'd set up shop in 1998. And that's the first time a book came out. The second was 1999. And it's just, it was just warming up then. This turf war between veterinarians and non-veterinarians to float teeth, it's been a turf war since then. I'd say late 90s, early 2000s. And I've already told you about the veterinary practice committee that invited me in the late 1990s because they knew this was happening and they wanted to address it. And in New York State, non-veterinarians were legal to float teeth. They still are. That's because all the racehorses demanded that the non-veterinarians stuck around and floated teeth because the racetrack vets had no time to do it. So yeah, I've been there. I've been through this whole battle, 14 years of it coming up. And finally, in 2002, I flew to Glasgow, Scotland to attend the annual BEVA, which is the British Equine Veterinary Association. It's the equivalent of the AAAP, which is the American Association of Equine Practitioners. So the BEVA conference, which focused on horse dentistry that year. Because of this subject, I was one of only 2 veterinarians interested in equine dentistry from the United States to attend. And the other one was one of the authors on this book. And he has also MRCVS. So he's basically from there. So I really was the only veterinarian to get off of the couch in America and get on a plane, fly all the way over to Glasgow, Scotland, and listen to what the British were doing. When the conference coordinator heard about my presence, and remember, I'd stated already that the equine veterinarians and the non-equine veterinarians who are floating teeth got together and they tried to work together. And I think they still are working together. They've had a lot of hiccups, but I still think that they allow non-veterinarians to float teeth as long as they pass this test. When the conference coordinator heard about my presence, she arranged for me to have a one-on-one lunch with Professor Patty Dixon of the Veterinary College at Edinburgh. So Patty Dixon, just to remind you, is on the cover of the latest issue of Equine Dentistry, the latest publication. And you can see his name over here, Jack Easley. And that's Patty Dixon right there, Padraic Dixon is Patty and Jane Schumacher. So Patty Dixon has so many publications, not even funny. Okay, so I had a one-on-one lunch with him. He has authored or co-authored more published papers and textbooks on equine dentistry than anyone. He presented the Frank J. Milne Lecture to the AAP, the American Association of Equine Practitioners, the highly prestigious invitation-only lecture where he discussed the evolution of the horse in equine dentistry. The interest could have been better, as seen by the mostly empty seats in the 1,000-plus seat lecture hall. I was there. It was so embarrassing. You could throw something and not hit anybody in the audience. It was just so thin because there are no other speakers assigned during this lecture because it's by invitation only, this lecturer. And it's the big cheese, the big head honcho. It's the guy who knows more about this particular subject than anybody on earth. And they invite him to the AAP. And I was so upset that so few people had come to the meeting and to actually listen to him. The following day, he joined a panel discussion discussing equine dentistry, which maybe had 80 people attending, which again, the AAP represents 8,000 people. And of those, maybe 2,000 show up for this meeting every year. This is before COVID. Maybe there's more, maybe less. I'm not too sure, but it's a heck of a lot more than 80. And only 80 bothered to attend. That's how little interest horse vets have for equine dentistry. But it's shocking to think that these veterinarians want to exclude all others from floating teeth, and yet so few of them actually perform equine dentistry. Okay, only the best get invited to give this talk at the AAP conference, yet very few attend. I assume this is because only a few equine veterinarians are interested in equine dentistry. Let me address this. There is a crisis in equine veterinary medicine where only 1.4% of all veterinary graduates, which in 2023 was 58 out of 4,000 graduates, go into the practice limited to horses. Of these, 50% quit within 5 years. Now, that statistic is from the American Veterinary Medical Association and the American Association of Equine Practitioners. So I'm not pulling this out of thin air. The number of new veterinarians entering horse practices is less than those leaving. And the AAP and the AVMA are moving fast to entice new graduates to join our ranks and, more importantly, stay. They do this by increasing the starting salaries, among other incentives. That includes more vacation time, more time off, better benefits, mentorship. They're trying to really butter this thing up to encourage graduates to stay. Anyway, the cost of employing veterinarians or maintaining the horse practice places more pressure on owners to generate an income. Some look to dentistry to help with their profits, which is a good plan, but there are some drawbacks. One of the first hurdles of becoming good at equine dentistry is becoming good at doing this. It is a skill that takes time to improve, made more challenging when the patient moves. The solution for many is to sedate the horse automatically. Is this the best option? for the horse. How does any medication affect horses that are healthy or who have underlying conditions such as metabolic syndrome or gut ulcers? All medicines, such as antibiotics, anti-inflammatories, and sedatives, cause a change in the gut microbiome, or what we call dysbiosis, leading to malabsorption, even ulceration. So, I repeat, is automatically drugging every horse that we see in the best interest of the horse? Another hurdle is the lack of scientific evidence providing the causation between any dental disease espoused by the College of Veterinary Dentistry, equine specific, and their solution. For example, recently, a board-certified veterinary equine dentist suggested, and just a side note, when you're board certified, it means that you hold yourself to a higher standard than just being equine veterinarian. You have passed several challenges and stood in front of your peers to say that you've reached this certain standard of excellence. And I'm just challenging that. I'm challenging that they actually have the science to back up what they're saying is the gold standard of being an equine vet. I don't believe so. I'll get into that. But anyway, let me go back. This board-certified equine dentist suggests that removing all incisor teeth is an acceptable treatment for this disease called equine odontoclastic tooth resorption and hypercementosis, which everyone calls EOTRH. But they don't have a cause for it, nor any proof that tooth removal is more than palliative. So worse, alternative options with a history of helping these horses are not only not mentioned, but laughed at publicly, as I heard several times at the AAP meeting with Dr. Dixon. They laughed at the idea that shredded mushrooms could be used to decrease the inflammation. They don't even know what causes this. And yet there's a preponderance of people using shredded mushrooms to quell the inflammation caused by this. And yes, it's a progressive and advancing disease, but we want to keep these horses comfortable without putting them through the aggressive treatment of removing all the incisors so their tongue just hangs out of their mouth. It's bloody. It's just horrible. It shouldn't be done. And if there's an alternative to doing that, why aren't these people mentioning it? I don't know. An even more complex problem exists in areas where only veterinarians are allowed to float teeth. And the desire of the horse owners to not have this happen is there. People do not want their horses automatically drugged, often to the point that they fall to the ground. They don't want their horses immobilized through medications, speculums, braces, stocks, and helpers holding their heads. However, with the restrictions imposed by government regulations, the horse owners have only three choices. One, they don't have their horse's teeth maintained. They just walk away. They don't want it done. Two, they suffer through a technique that they don't like. Or three, they ship their horses to a place where floating is legal, in the way that they want it done. This last choice places the financial and time burden on the horse owner and increases the horse's risk. The first choice neglects the pain the horse suffers from the sharp teeth, but addresses the suffering the owner goes through as their horse becomes an object rather than a living, breathing patient. Further, what if the horse owner feels that the veterinarian isn't doing a good job? They can't mention this observation because there are too few veterinarians willing to come to their farm as it is without offending the floating veterinarian, where they're concerned about their competency. Worse, many veterinarians include dentistry in their annual wellness visit, forcing the techniques veterinarians use on the horse and owner because of the discount given for the wellness visit package. I hear this all the time. No, doc, I'm not using you as a vet to do the teeth because my vet is offering a deep discount if I do shots and Coggins and do all this other stuff. In other words, they sign a contract. So I can't do the teeth. So they're locking me out. In other words, forcing horse owners to use a veterinarian for routine dental maintenance performed for over 100 years by non-veterinarians is unfair to the owner who wants to use a time-tested approach to dentistry for their horses. Let's look at time-tested, observational, anecdotal evidence and ask if it is better or worse than peer-reviewed, randomized controlled trials, or what I call RCTs. The first thing to do is find quality RCT papers in equine dentistry, but unfortunately, none are available. Quality comes from various factors, including, but not limited to, confounding variables, the power of the study. In other words, how many horses do they look at? The statistical analysis, such as significance or relative risk, and bias of the subjects and the study in general. I've had plenty of podcasts on why science is bad in veterinary medicine and in all nutritional medicine and basically human medicine as well. If you want more information, you can listen to those. The papers and texts I read on dentistry and horse published in veterinary journals or presented at veterinary conferences are mostly case reports or collections of case reports to establish a pattern. These collections often have dozens to hundreds of horses nicely grouped by age, breed, or pathology. In other words, they're all between 1 and 5 years old, for instance, or they're all thoroughbreds, or they all are suffering from this one disease, EOTRH, for example, so they exclude all others. Occasionally, an RCT appears with 10 to 20 horses selected due to age or breed, and an attempt to show causality made using poorly formed statistics for all horses on the planet. It is ridiculous to think that a dental disease studied in thoroughbreds, stabled at a racetrack, eating pounds or kilos of grain, will have any causative association with the outcomes of horses living in another country fed differently that have a different use. Do you see what I'm saying? So whatever studies come out are underpowered, poorly designed, and doesn't help the horse that's living in Mongolia or Iceland or the Middle East or China or you name it, South America, anywhere. I mean, it just doesn't have any determination on those factors. And yet veterinarians will use them as evidence that they should do something with horses. And it's just poor evidence. No RCTs determine the long-term outcomes of floating teeth using any technique. Let me repeat that. No randomized controlled trials determine the long-term outcomes of floating teeth using any techniques. No one has done any studies to show hand floating or power floating, with or without medication, has any bearing on the outcome. You and I both know that the only thing that has bearing on the outcome is the ability of the person doing the floating to do what they say they're going to do. There's been other papers where they talk about balancing the mouth, balancing the jaw, filing the front teeth, and getting balance between the front and the temporomandibular joints. None of it has any science. It's incisor reduction, nothing. Filling cavities in horse teeth, no science. Yes, it can be done, but just because it can be done, should it be done? There's no evidence of that. Anyway, this statement means that no person on this planet can actually say what is best for horses regarding their dental care. All there is anecdotal evidence and observational studies. Yet, in the past 25 years, no governing body has asked me to contribute my accumulated knowledge from 41 years of looking at 80,000 plus horses. Instead, they say I do not, quote, fit the standard of practice, according to a handful of people unwilling to find the answers needed to help the horse. It is so frustrating. 80,000 horses that I've seen, all breeds, all walks of life, all purposes. I have actually done the teeth of a horse that has won the Kentucky Derby and has gone to the Olympics for the United States team and other teams. I've done their teeth and they've competed just fine. I've done horses that belong to the little girl with pigtails and freckles that has a pony that costs her $300 that sits in the backyard. I've done them all. I've done everything in between. I've got so much anecdotal observational study information that I can come up with immediately. and how to get the back teeth without having to jack the mouth open. I've done it for so long, for 41 years, and yet nobody is willing to call me up and ask, let's take a look at this and compare it to what we have. Let's start doing a study and see what really is in the best interest of the horse. Now, I was there in 1984 to 1998 when there were no textbooks, there was nothing out there, and all of a sudden somebody came out with power tools, and the first textbook comes out in 1998. In 1999, there's a conference in Florida using a non-veterinarian telling me to go in and start filling cavities in a horse's teeth. And nowhere is anybody saying, hey, have you looked at the reason why we're having cavities? Why didn't we have anything about cavities in horses' teeth in the 1984 textbooks? Why was there no fractured teeth? Why was there no EOTRH? Nobody's coming up with a reason why. They just see the pathology and they think they're the only people who can take care of this pathology. Fine, but you're avoiding the 98% of what is done in dentistry in horses, which is taking away oral pain in the horse's mouth, allowing the tongue to move around, distribute the saliva, which has the antibodies in it, to clear up all infections, to heal the disease, and stop feeding grain, which is causing the change in the oral microbiome that's causing the cavities, just like in humans. It's so painfully obvious that if we took away all the causes, these veterinarians would be out of a job. I mean, it's simple as that. The only thing is the horses keep chewing. And if they keep chewing, their teeth get sharp, and we have to come in there and take those edges away. Anyway, I'm almost done with this. Let me keep reading. There are good and bad equine dentists, regardless of having a degree in veterinary medicine. What counts is experience, but more importantly, sharing this experience. I've done so since 2007 on all social media platforms, several websites, and my podcast. 2007, I answered all the questions about equine dentistry. You can see them. They're all on YouTube right now. You can see them on my website if you go to theequinepractice.com and look at frequently asked questions. I made those videos answering each and every one of those questions in 2007, and there is no change. And what I say works. So don't give me this, I don't have this standard of care. You don't know what the standard of care is. You're way off base, you guys. Horse owners know there are other approaches to dentistry, but because of laws, they cannot use them. In other words, these governing bodies know that I'm doing a good job, but they are afraid or whatever to come and say, gee, Dr. Tucker, can we spend a day or two with you and see what you do and compare it to what we know? It'll be eye-opening. I guarantee it, because every student comes here, their eyes pop out of their face the first time they go in and they feel the teeth rather than look at them. And they see the response of the horse saying, thank you. They're seeing the gratefulness in front of their eyes. And I've videotaped this many times. That's on YouTube as well. Okay, veterinarians are worried about their practice, either in the solvency or their credibility, if non-veterinarians float teeth. However, we become horse vets to help horses, and we can do this by using non-veterinarians to be our eyes on the dental issues of the horses we care for. Legislation in the United States, the US states, where non-veterinarians are allowed to work on horses' teeth, states that they only use hand floats and do not give any medications. That seems pretty simple. If you want to work in Florida and float teeth and you're not a veterinarian, use hand tools and don't use drugs. It's that simple. Nobody enforces that, by the way. Allowing them to work frees up the veterinarian's time. Veterinarians have more on their plate than they know what to do with, right? And, you know, if they're out floating teeth and they get a colic call, they're leaving. They're not going to float your horse's teeth. They're going to leave the horse half done and go to take care of the colic or the broken leg or the horse that's gone through the fence. That's what they're there for. They have the techniques and skills to do that. Or if your horse has a busted tooth, let the vet take care of it. They know exactly how to do that. But for routine filing, they don't have to do it. And that frees up their time so they can be a better veterinarian for all the other things. They can even be part of the practice, meaning the non-veterinarian can be employed Okay. And the veterinarian can bring in some of that income, even though he's putting up the income of scheduling the appointment, etc. They can make some money off of that. With training, non-veterinarians are sentinels for further problems, and the veterinarian can apply the training and skills required to address the pathology. So the non-veterinarian goes out, starts to float the teeth, says, oh, we have a fractured cheek tooth, and they refer the horse to the veterinarian who takes care of that. They can administer the painkillers, they can extract the tooth, and do the x-rays, and do all the stuff that they want to do, which is fine. But would that horse ever have been seen if the tooth floater hadn't been there, the non-veterinarian dentist? This approach of working together becomes a win-win for the horse owner, the non-veterinarian floater, and the veterinarian. Further, in an age where the supply of equine veterinarians is shrinking and the location of care is focused on urban areas, the following can occur. 1, horse owners will be more willing to provide their horses with the necessary routine care, which is a win for horses. 2, more people can make a living income in the horse industry by providing maintenance for horses, which is what farriers have done for a lifetime. 3, the vet can employ a non-veterinarian to add to their income by offering floating through their practice. The owner can choose between hand floating by the non-veterinarian or an advanced approach offered by the veterinarian. Either way, the client is still in the veterinary practice, is receiving all the other care the veterinarian has to offer, hasn't lost the client to anybody. It's humbling when you give work to somebody else in your practice and they do a darn good job and everybody says, oh yeah, send Sally, she's great. Send her, she floats teeth like I've never seen before. And you sit back and say, yeah, I'm making money and I'm seeing all the fractured teeth that these people probably wouldn't even have me out there for. And finally, the horse owner can feel confident that if a pathology is discovered by the routine floating, the veterinarian can follow up. I mean, these are really compelling reasons. So after 51 years of working with horses and 41 years of floating teeth, it is becoming evident that the turf battle between the veterinarian and the non-veterinarian over who should be floating horses is doing nothing but making it difficult for horse owners to get the routine care they need. We can create a better solution for our horses if we all start working together. More horse vets are needed, especially in rural areas, to provide basic care, but the number of them is growing smaller. Owners cannot afford the time or money to ship their horses to a clinic for this routine care, and they don't have the skills and possibly the physical ability to float horses. Horsemanship dentistry is teachable and can be done effectively without medication. I know this because of my experience with a number of horses I've floated and the success of students learning this technique. There remains a simple fact about horses' teeth. If a horse is chewing, the teeth need doing. With a decline in the available horse vets in rural areas, their work is spread thin among the horse population. Non-veterinarians are performing a needed service, and veterinarians can learn to work with them as they have with other non-veterinary horse professionals. They are not there to diagnose, but as basic, the non-veterinarians are not there to diagnose, but as a basic service providers with eyes and ears that can help to promote the local veterinarian for things they're well trained for. So thank you for listening to me on this podcast. I hope and pray that this student can, with the help of some professionals, help their veterinary board understand that she is not trying to take bread or money off the table of the veterinarian. She's actually providing a service no different than any of the other professionals. And that the word dentistry in the Veterinary Practice Act is applying to mostly dogs and cats, and it can apply to horses, but it should not apply to the routine care of removal of sharp points. As soon as the sharp points are gone by whose ever hand, they're going to be back there in 3 to 9 to 12 months. They're going to be back and they have to be removed again. Just like your fingernails, just like the horse's hooves, they just keep erupting and they keep getting sharp because the tongue makes it that way. So I hope I haven't bored you all to tears, I hope this podcast will help see some other veterinary boards see the light that this is a great opportunity for veterinarians to move forward and offer both services and not shut down one service thinking that yours is better, because there is no proof that one way is better than the other. I think they both work just fine. Just one is completely different than the other. And horsemanship dentistry is my passion, have been for so long and probably will be for years to come. Anyway, thanks for taking time and being with me. I appreciate it. And it's Doc T. I'll see you next time. Bye.
Hey everyone, Doc T here. Thank you for listening to my content. Would you do me a huge favor? Would you please subscribe, comment, like, thumbs up, and give a star review? However it's presented to you, I want you to do that. There's two reasons. The first, of course, is to improve this product. This way I know what you like, what you don't like, what I can improve upon, what topics you want me to cover. But more importantly, it's also going to help others find me. And by doing that, you are now engaged in this mission of helping horses thrive in a human world. By you helping, we can reach others. And that I would be so grateful for. And remember, go to thehorsesadvocate.com for updates on this information. Thehorsesadvocate.com. And again, thank you so much for being here. Doc T out.